Hi, everyone. My name is Emily Wolfenden. I am a current second-year family medicine resident at the University of Utah, and I'm applying to sports medicine fellowships this summer. And this is my poster titled The Association Between the Female Athlete Triad and Self-Reported Depression and Anxiety in Athletes. This project was performed in coordination with a preceptor, Dr. Emily Krause, over at Stanford. So for some introduction, the female athlete triad includes three interrelated factors: low energy availability with or without a clinically diagnosed eating disorder, menstrual dysfunction, again with or without amenorrhea or the absence of periods, and low bone mineral density. It's been theorized that mental health illness can both contribute to and result from low energy availability, but there's really limited data or literature that exists describing the relationship between the female athlete triad specifically and mental health symptoms such as depression or anxiety. So the purpose of this study was to investigate the relationship between the female athlete triad and self-reported depression and anxiety symptoms in female athletes. This was a cross-sectional survey study of high school, collegiate, and post-collegiate athletes. These surveys were distributed via both social media and via athletic trainers for those high school and collegiate athletes. Surveys were distributed in early 2021, and we collected a lot of data from these participants, including their age, their sex, their training history, including what sports they are training in and how many hours per week they train, their menstrual history, including their age of menarche or their first menstrual period, the interval between their periods and their menstrual period length, a history of bone stress injuries and eating disorder behaviors, including history of disordered eating versus eating disorders clinically diagnosed. These questions were derived from a number of questionnaires, including the Female Athlete Triad Coalition Consensus Statement Cumulative Risk Assessment Tool, which is a very long name, but I'll explain that tool a little bit later. The PROMIS Emotional Distress, Depression and Anxiety short form questionnaires, and the eating disorder examination. And then our wonderful statistician did some multinomial logistic regressions and adjusted for age and triad components to come up with our results. So as promised, up here in the methods, I have some further explanation of the female athlete triad cumulative risk score. So over on this left-hand side, you can see our 5 variables included in this risk scoring tool: oligomenorrhea and or amenorrhea, age of menarche, low body mass index, history of prior bone stress injuries or BSIs, and low energy availability. And then in these columns, you can see the criteria for classification of these participants into either low risk, which would be assigned 0 points, moderate risk, which would be assigned 1 point, or high risk, which would be assigned 2 points. The female athlete triad cumulative risk score is the sum of the number of points in all 5 of these rows. And I'll zoom out a little bit. So down here, you can see the results of our study. This is a lot of information. These tables are describing the odds for development of mild, moderate, or severe depression and anxiety for each 1 point increase in female athlete triad risk score. So for each 1 point increase in energy availability risk score, participants had a 1.26 times the odds of developing mild depression, which was clinically significant, 2.26 times the odds of developing moderate depression, and 4.59 times the odds of developing severe depression. So we got clinically significant values in both the moderate and severe depression categories. We've also found that participants, for each 1 point increase in their energy availability risk score, had increased odds of moderate and severe anxiety. No additional factors included in the female athlete triad risk score led to statistically significantly increased odds of mild, moderate, or severe depression or anxiety. We further stratified our participants' histories of disordered eating and found that participants who had a clinically diagnosed eating disorder specifically had increased odds of moderate and severe depression and anxiety, which kind of confirms our previous findings. So we acknowledge that this study has a few distinct limitations, notably possible selection bias. We acknowledge that participants who have a history of disordered eating or a very high volume of training or history of bone stress injuries may have been more likely to take this survey than participants who did not fall into those categories. We also acknowledge that COVID may play a role in participants' depression and anxiety symptoms and severity of symptoms. We controlled for this by asking participants about their pre and post-COVID depression and anxiety symptoms and found that there was no significant difference between pre and post-COVID depression and anxiety symptoms. So in conclusion, we found this observed link between low energy availability and moderate and severe depression and anxiety among our study population. This observed link between the triad and depression and anxiety symptoms highlights the potential impacts of disordered eating and eating disorder behaviors on mental health. We know that future research is needed to formulate prevention and treatment strategies for mental health illness in this athlete population. Thank you so much.